Good evening, everyone, and welcome to the Thriving Dentist Expert Panel. I'm Angie, and I'm very glad you're here with us tonight. So, tonight's conversation is the profitable ethical dental practice. Why the highest margin clinics are also the most patient centered. We're going to talk honestly about what it takes to grow a dental practice in a way that protects patient trust, strengthens the team, and still creates a healthy, profitable business. Now, this is not a conversation about choosing between values and performance. It is about how values, communication, leadership, and smart business decisions can actually become the foundation for stronger long term growth. Now, a few housekeeping notes before we begin. We are recording tonight's session and you'll receive a replay link after the webinar. However, don't let that make you passive. The real value is happening live in the examples, the panelists' answers, and the questions that come up from this community. So please use the Q&A button for questions you would like the panel to answer. You can use the chat for conversations, reflections, and quick comments. I'll have my eye on both feeds throughout the session. And with that, let's get started. Now, before we move into the panel, I want to frame one important business reality for dental practices. More inquiries should turn into more booked appointments. But very often, the booking gap starts before the phone ever rings. A practice may be attracting price shoppers or insurance driven leads instead of long term value focused patients. Now, that is where trust and positioning matter. Practices need to target the right audience and confidence faster through proof, reputation, education, and local relevance and make scheduling obvious. So the idea here is simple. Fix the booking gap with targeting, trust, and clear path schedule. That connects directly to tonight's topic. Because patient centered growth is not only about what happens in the chair, it also starts with who finds you, what they believe about you, and whether they feel confident enough to take the next step. So, we'll hear more from Equa Marketing later in the program. So, tonight's panel is built around five key discussion points. First, profit and ethics can coexist, why sustainable growth and strong values go hand in hand. Second, when trust drives revenue, how patient-centered care improves retention, referrals, and long-term value. Third, the hidden cost of shortcuts, why unethical decisions often cost more than they make. Fourth, build a growth model you're proud of, creating pricing and goals that reflect both values and performance. And then fifth, lead with values, grow with confidence, how to protect culture and ethics without limiting profitability. Now, quick note before we introduce the panel, Dr. Benjamin Atkins was scheduled to join us tonight, but he may not be able to attend. But don't worry, we're still in excellent hands with Livy, Angela, and Dr. Laura, and we'll make sure the conversation covers the same key themes around trust, ethics, profitability, and patient-centered growth. All right, so let's get to our panelists and into the work. First of all, I'm very pleased to welcome Levi Barlevi. Levi is the founder of Polished Legal and a healthcare business attorney who advises dentists and physicians on practice ownership, transactions, and growth strategies. With more than 15 years of experience and more than 1,000 healthcare deals led, Levy has guided professionals through practice purchases, sales, partnerships, and other high stakes transitions. His work combines legal insight with clear, practical communication, helping dental professionals make better decisions when ownership, growth, and risks all intersect. Welcome, Levy.
Thank you. Thank you, Angie.
I'm also delighted to welcome Angela Golden. Angela is a results-driven dental advisor and certified exit planning advisor with more than 30 years of executive experience in dental practice ownership, management, and strategic growth. She helps private practice owners increase profitability, strengthen leadership systems, improve operations, and maximize long-term practice value. Her work focuses on helping dentists move from clinically driven practices into scalable businesses that are more profitable today and more valuable tomorrow. Welcome, Angela.
Thank you, Angie. I'm happy to be here.
And finally, I'm also pleased to welcome Dr. Laura. Now, Dr. Laura is the founder and principal dentist of Corner 32 Dental in Sydney, the founder of Con Practice Consulting, and the author of The Emotionally Intelligent Clinician. She's known for building a patient-centered practice where clinical excellence, strong culture, and commercial success work together. Dr. Aurora teaches emotional intelligence strategies that help clinics communicate clearly, reduce patient anxiety, strengthen trust, and lead teams with consistency and psychological safety. She brings a deeply practical perspective on building a practice that is clinically excellent, financially strong, and deeply human. Welcome, Dr. Laura.
Thanks so much. I'm excited to be here, Angie. Appreciate it.
All right, at this point, I am going to stop sharing the slide deck so we can move into the panel conversation. All right, let's start with Levy. I want to bring you in from the legal and ownership side, especially because you see practices during major transitions, acquisitions, and partnership conversations. So in the deals you're seeing right now, where do acquisition structures or ownership models most commonly create pressure that quietly undermines clinical ethics or patient-centered culture?
Thank you again, Angie. What I think leads to the most problematic issues in a practice transition is when a buyer is over leveraged or undercapitalized in the practice. We see that, everything that's true in personal relationships, a lot of that stuff can be mapped onto businesses as well. So if you have a lot of debt that you're financing, or you don't have enough money in the bank to cover situations that you'll inevitably have in your practice with hiccups, that immediately leads to pressure on the clinical side to generate more revenue, often in a way that is cutting corners. And so I think from a buyer's perspective, going into any transaction or any ownership structure and understanding how much capital you need in reserves to ride economic waves, but also to understand what kind of expenses you have and what kind of financing you can actually tolerate is the best way to position yourself to have growth without having those issues on the clinical side.
Mm-hmm. All
And
right.
if I can quickly add, in reading Dr. Laura's bio, it triggered something in a study that I read. Revenue is created on the growth side, but it's also minimized on losses, right? Risk mitigation. And the best doctors, the ones who get sued the less, studies have shown that doctors who have that high emotional intelligence, and Dr. Laura could probably speak to this, and spend more time with the patients early on building that relationship, have a lesser likelihood of getting sued when things inevitably have problems. And, building on that is going to reduce risk in your relationship on the patient side as well. So.
All right. So, Angela, a lot of owners want stronger numbers, but the team often feels pressure before the owner sees the full impact. What failure shows up first for owners when profit targets outrun leadership habits and the team feels it during the day?
Well, I'm going to go back to Levy's comment that he just said, because trust and having the patients trust you and value you is the most important, because trust deteriorates before profits do. The first failure is rarely financial. It's always a leadership credibility. And team members, they feel pressure to hit the numbers or to make sure that they get the production in instead of serving the patients.
Mhm.
I see it oftentimes, front desk members hesitate to have authentic conversations. They don't want to really go into details with the patient. They just want to show the numbers and this is what your copay is going to be, and that's it. They don't go into authentic conversations. Hygienists do this a lot. As a former hygienist, I was guilty of it as well. That when you're focused on production, and numbers all the time, you're not having the educational, compassionate, I'm here for your health conversations. And it turns into, I have to make my numbers. So you're not having the same type of conversations. You're not having the same empathy. You're not educating the patients to the skill that you should be. And even I see it so often that morale declines in the practices, turnover increases, and patients' trust erodes. When leadership habits lag behind production goals, the intangible assets of the practice begin to erode. So if a practice wants to sell, buyers don't just acquire equipment and charts. They acquire culture, the stability of the practice, and a predictable cash flow. One of my favorite things that I tell practices all day long is patients don't leave because you missed a production goal. They leave when they stop believing in your recommendations and the patient's best interests.
Mhm. That is a great point. Dr. Laura, I want to bring this down into the patient experience. So, one of the most common tensions in practice is the pressure to stay on schedule while still giving patients the calm and clarity they need. So, how do you choose between schedule efficiency and patient calm when anxiety is visible in the room?
Yeah, that's a great question. And, both of Levy and Angela have brought up some great points already so far, which I'd love to chat about. So I think it's not about choosing between efficiency and calm. I think calm is the key to efficiency. So when, we deal with anxiety all the time, patients don't want to be in our chairs for the most part. And so the key is they're in threat mode, fight or flight. They're not able to think clearly and they're panicked a lot of the time. So our job first is to calm that patient down because a patient who is feeling threatened is more likely to disrupt the appointment. They're going to ask unproductive questions. They're going to resist, whatever you're trying to do. If they feel the smallest amount of discomfort, they're going to want to stop and pause. And all of these things are delaying the appointment and disrupting the efficiency in the schedule. So I think spending that little bit of extra time at the start of the appointment to build that connection and rapport and calm the patient down is the key to then saving, 10, 20, 30 minutes throughout the appointment, depending on what we're doing that day, and helping things run smoothly and calmly. Now, having said that, to Levy's point about emotional intelligence, and thank you for bringing that up, I think the key to a calm patient is a calm clinician. And a lot of us have not been taught those human skills, how to regulate our emotions. And we are the driver of the mood and energy in the room. So if we are not able to calm ourselves and be effective at our job, then that energy is going to translate to the patient and then everything falls apart essentially.
That is such a practical reminder, that calm is not separate from efficiency. Angela, do you have anything you'd like to add into that, or or Levy, would you have anything that you'd like to add into that as well?
Angela,
I
you
agree.
can jump in.
I think flight or flight or fight or flight is real. And I 100% agree with her. Laura, that's amazing. I think you have some very valid points there.
What I always think about, and something I develop in my own practice, representing doctors in transactions that are very, very anxious because they're so much at stake at a critical point in their life is from a clinical standpoint, you always want to know the experience of your patient before they even came into your practice, right? They're taking time off work. They have to drop their kids off. They have to find sitters. They're going into something that's very highly costly. They potentially have pain. And so, how you invite that patient into your practice from the first phone call to the front desk to how you sit by them in the dental chair is can be sensed when they walk into the practice and the first interaction they have with the practice. And a lot of times, in my most successful clients, they tell me, we've won them in the first phone call because when they call the office, they can sense the person's smile on the other end of the line, which is much more welcoming. And you think about it sometimes, you call somewhere, just close your eyes, and are they just saying, hello, or, are they smiling and more inviting to the person on the other line? And that's your first interaction. And so understanding that journey is going to help you when you're actually doing the clinical work in the operatory.
Yeah. Dr. Aurora, I want to come back to you again. This is a bit of a follow-up question. Especially when cost becomes a real concern for patients. Which patient trust pattern matters most when cost pressure makes people delay care or question the timing of treatment?
I think all of that comes back to building a relationship with the patient. So cost is something that, or the value that we see in something, right? So if we build a relationship with that patient, if we really want something, if we value something in life in general, then we find a way to get the money, to make it happen. So cost is usually an issue where patients don't see the value or they don't believe that that's genuinely in their best interest. And that all comes down to the communication that the clinician has with the patient. If the patient feels pressured or that the intention of the clinician is not genuine and authentic and in their best interest, then excuses like cost are going to come up. But the fact is, a lot of the time, cost is something that people throw out there as an objection because it's an easy thing to say, and a lot of people are uncomfortable having that conversation when really there's something more underlying, whether they don't trust the situation, whether they've had past bad experiences, or some other thing that's bothering them and stopping them from moving forward. Because even if cost was an issue purely financially, you would still go ahead with treatment, but you may do it staged over time. So I think the real key is when there is some kind of objection coming up, the better relationship that we can build with that patient, the more safe that we can make them feel in the space and in the chair, the more likely we are to uncover what they're really thinking and feeling and get to the bottom of it so that we can help them in the best way possible.
All right, so I want to pause here for a moment because everything we've discussed so far is exactly the right foundation. Trust, clarity, patient-centered communication, and growth that the owner can feel proud of. And there is one more layer that makes that work land. The right patients need to be able to find you, understand your value, and feel confident enough to book. Right now, someone in your area may be searching for a dentist that they can trust. Someone else may be comparing practices, reading reviews, or trying to understand whether your practice feels like the right fit. The question is, when the patient is looking, does your practice show up clearly? And when they find you, do they immediately see the trust signals that make them comfortable taking the next step? Now, that is where Equa Marketing comes in. Equa Marketing has more than 18 years of experience supporting dental and healthcare practice owners with digital marketing strategies designed to improve visibility, trust, and booked appointments. Now, tonight, as a gift from Naren Aruraja, who is the CEO of Equa Marketing, Equa is offering a 10 days a practice growth session built specifically for dental practice owners. Now, this is a $900 value. You walk away with clearer read on where your practice value sits today, the patient retention gaps that may be quietly eroding your worth, the online trust audit that a smart buyer or patient may be already running, and a growth blueprint for before, during, and after a handoff. You can scan the QR code on the screen, visit www.thrivingdentist.com/panels/MSM, or click the link in the chat. Book before you log off. There are only a few slots available. And again, this connects directly to tonight's conversation, the expertise, ethics, and patient-centered care we're discussing deserve to be visible to the right people. So I'll give you a moment to be able to scan the QR code that is on the screen. All right, so let's come back to the panel. Let's go back to Levy. So what's the decision rule you give owners to distinguish a growth opportunity, a partnership, acquisition, or DSO arrangement that strengthens the practice from one that erodes it over time?
Well, you mentioned a few different types of models, and so I'll quickly go through each. For partnerships, what I tell, and this is mostly young doctors, is the biggest mistake you can make in choosing to partner up is the fear of doing something on your own. That often leads to a lot of friction down the line because you're substituting, you're trying to solve an emotional problem with a legal structure. And what I see with a lot of doctors who partner up when they're younger in their career, they may start out the same in terms of economics, their life, married, not married, no kids. But over the course of the next 10, 20 years of their life changes dramatically. Some will get divorced, some will have kids, some will have different goals. They might want 2 or 3 practices, others might want to slow down. And so it was the wrong reason to partner up, and all the outside issues cause a lot of friction. And so the best partnerships, I think, are those where the skills are additive. Someone either has a clinical skill set, does a specialty work, or operationally does something very well that you don't want to handle or you're not good at. Those partnerships, if structured the right way, can do very well. For acquisitions, I think the rule is very simple. If you are targeting a practice to acquire and you see that you have clinical skills that the current doctor, maybe care is referring out, maybe you do specialty work that the current doctor doesn't, orthodontics or some endo work or perio work, then you can keep those patients and grow the patient base without referring those doctors out. And I think the last one you said was DSOs.
Yeah.
On DSOs, uh, you really have to be careful in these transactions in terms of when to get into them and why to get in them. And culturally, it's the biggest driver in terms of success or not success in a DSO relationship.
All right, Angela, I want to move into the longer term value of the practice. How should owners weigh higher short-term production against enterprise value when staff trust is starting to weaken?
Wow, that's a loaded question. When you're looking at enterprise value is built on transferable systems and relationships, okay? If your profitability depends on constant pressure from the owner, you've built dependence on the owner rather than enterprise value. In fact, 80% of enterprise value is tied to the practice's intangible assets, When I talk about intangible assets, I'm talking about your human capital, which is your employees. I'm talking about customer capital, which is your patients, your patient retention, and your hygiene recare systems. When I talk about structural capital, that's the fourth C in capital, the strength of the systems and processes in the practice. So that's your recare systems, that's your SOPs, if you have any. Some don't. And the fourth is the social capital. That's the strength of your culture, the strength of the patient's referrals, the patient's reviews, and the culture in your practice. When you see a lot of high employee turnover or reduced case acceptance, poor online reviews, or lower patient retention, that's going to decline the enterprise value of the practice. So my focus is always to increase the enterprise value. I do it through value acceleration, and it's a system that I don't think anybody else has really used, but a cohesive, trusted team can command a higher and stronger valuation than a practice with an inflated short-term numbers. Like, they go off of, oh, well, we've got to have this production every day. Otherwise, we're not going to work. That's not going to work. That does not build strong systems. That does not build strong enterprise value. The bottom line is your revenue is rented every single month. Trust from your employees, from your patients, from the community is what compounds for years and years to come. That is what builds enterprise value.
All right. That's such an important distinction. Dr. Laura, I'd like to come back to you. What breaks for the patient when a clinician rushes a recommendation and anxiety is already high?
Yeah, so that's a good question. It basically comes back to what we talked about earlier in terms of patients are unable to make decisions clearly and properly and move forward with treatment if they're feeling pushed or rushed or pressured. And Angela made a really good point where if you have these production numbers and you're feeling this pressure to hit a particular target on a particular day, that is putting your focus on short-term gains with a big long-term loss consequence, right? It's much cheaper to retain an existing patient than it is to constantly acquire new patients. And the more that we break that trust, because essentially that's what breaks, right? The relationship breaks, the trust breaks. And in such a vulnerable relationship that a patient has with their healthcare provider, particularly in dentistry, but anywhere across healthcare, when that trust and that relationship breaks, then the patient is not going to feel confident and comfortable moving forward with treatment, and they're not going to follow through, and they're not going to come back. So worst case scenario, you've lost that patient, but you've pushed them into this thing today to hit your production target that day. So it's a really short-sighted way of looking at building the value in your practice. We have to be looking at doing the right thing by the patient, taking the time initially to build those relationships, because ultimately that's going to manifest in way more treatment for that patient long term that they need, and then word of mouth referrals. Because if a patient loves their dentist and they found somebody that they're happy with, they go and tell everybody about it. And so that's how your practice grows. Obviously, marketing and all those things are important, but how much can you market if you're then bleeding patients out the other side? So a patient comes in, you don't build the connection, and they're gone. That is a very expensive exercise to maintain, and it will be the end of your practice, essentially.
That's actually really perfect. Let's get back to Levy. Levy, a major transaction does not only affect the owner, it affects the team, right? The culture, the patients, and the reputation of the practice. So what should happen in the legal and operational groundwork before a major transaction closes to protect both the practice's reputation and the patients it inherits?
Might need a couple of hours to talk about this, but I'll make it quick. Um, our practice has so many moving parts to it. Patient care, scheduling, AR, employees. There's so many systems and parts to it. And it's as if you're juggling a ball and someone's trying to jump in and catch the balls midair when you have a transaction handoff. So there's so much legal stuff, but more importantly, even operationally. I would say number one, from a buyer's perspective, I always tell my clients buying a practice is like jumping into a moving car. It's already running and it already has systems running, and some of them might work well and some of them might not work well. But your job is to take that control of the car as steadily as possible. Don't break things fast. Don't make too many operational changes fast. You want to first earn the trust of the employees. That's going to help you earn the trust of the patients. And you want to hear and listen to what works and what doesn't, and slowly start making changes over time. From a transactional standpoint, patient-wise, who's going to communicate to the patients about the change and the transition? Have a plan beforehand, working with a consultant like Angela, to make sure we understand is who tells the patients how they're told and when they're told, and who tells the staff how they're told and when they're told. So we have a warm handoff, and that can be baked into legal documents. We don't want to give people just a very cold notice. We want to bring the seller and the buyer together very warmly in that transaction at the end of it, because a lot of times the patients don't know and the employees don't know until the transaction is actually consummated. And then finally, from a reputational standpoint, the buyer wants to understand the reputation of the practice going in by doing their diligence. That's legal due diligence on, issues related to compliance, patient care, lawsuits, regulatory issues. And then it's also operational what kind of reviews do they have? What's the problems? And they want to be prepared to address those as they become an owner. But also from a seller's perspective, if you really care about your practice, if you've been in your practice for 20 years and you care about your staff, you also need to do diligence on the buyer. And I've seen this happen a lot where sellers want to sell and maximize their sales. They do care about their staff, and so they take the DSO route. And once it ends up happening is if the DSO is not in that area, doesn't understand the culture, doesn't understand the practice, or potentially has a bad reputation, that can break the practice. Employees leave and then patients leave. And so if you don't have a good fit on the buyer side with the seller side, whether you're working through a broker to help that or a consultant to help that transition, a lot of things can break. So you want to be very gentle, and you want that spelled out in the legal documents, but also in the planning before for after the sale.
Mhm. Let me ask you a follow-up question as well. Now, we were talking about patient-centered care, right? Does not always mean saying yes to every patient request. Sometimes protecting the patient and the practice means saying no as well. So what rule helps a dentist decide when saying no to a patient protects the practice?
Well, I think this is not true just for dentists. This is true for any business owner, and even in our personal lives, right? You have to have a good set of boundaries in terms of how you run your life and relationships and how you run your business. And knowing those boundaries, including how much can I take on, what kind of patient do I want, what can I do as a clinician? You don't want to play a superhero if and offer services beyond your skill set. Once you blur those boundaries and you pass over them, that's when you invite problems into your practice. So I think it's not just dentists. Being able to say no is the is really when you know you've succeeded in your practice, because you know where your boundaries are in terms of all your systems, your patients, your employees, and how you run things.
Mhm. Let's get back to Angela. So, which number would you pull monthly to see whether ethical profitability is becoming real across the practice?
Are you asking for one number or multiple metrics?
It's up to you.
Okay. Well, the one thing when it comes to ethical profitability, um, in my opinion, the number one number would be patient case acceptance percentages, because patient case acceptance reflects whether the patient believes in the diagnosis and trusts the provider who told them that diagnosis. High case acceptance is achieved through education, not pressure, not sales, not being the salesperson, but it indicates ethical alignment and effective communication from the hygienist, the dental assistant, the treatment coordinator, and the doctor. So that communication line has to be the same throughout the practice. That might be the number one thing that gets patients to accept treatment. I would never evaluate a case acceptance in isolation. I want to understand the whole picture. So I would really want to know not only case acceptance, but hygiene reappointment rate, because that is also a number that, in my opinion, shows me that they trust their hygienist, they value their appointments, and it indicates loyalty. I also want to know how much team turnover there is in the practice, because if there's a high team turnover, that indicates that the team isn't trusting their leaders, and it reflects long-term relationship strengths. As an exit planning advisor, I always look at EBITDA, and EBITDA demonstrates operational efficiency and also indicates buyer appeal. And the very last thing is, I would say, the new patient referral rate. New patient referrals coming from other patients means that the patient base trusts you, and that means that if they're referring friends and family, they trust your opinion, they value your guidance, they value your diagnostic skills. That's huge. In my opinion, the healthiest practice don't have to sell treatment. They earn the confidence of the patients that allows the patients to say yes. Confidence and trust is everything.
I've heard that a lot throughout this conversation, confidence and trust, and I think it's a beautiful thing that I think everyone needs to put into practice. Angela, if would you mind if I ask you a follow-up question on that? How should an owner review that number with the team?
Well, there's a few different ways. You can run reports through whatever practice software you're using. There's always the treatment acceptance report. I would ask that when you're reviewing that with your team, you're not labeling it to, let's say, you have 4 associate dentists, and you break out the treatment acceptance, and one doctor has 13% acceptance and the other one has 57% acceptance, and the owner doctor has 75% acceptance. I would ask that you do not compare, but look into what happened at that visit, what was diagnosed, the notes that were taken, and if you have any way of overjet or Pearl or recordings of any sort, that builds a foundation of what we can evaluate. So assessing the situation is always the key. You never want to just say your case acceptance is so low, you need to do better, you need to do better. But really assess why. Why is that case acceptance low? And compare and contrast to why somebody else's is higher. Reviewing the questions that you're asking the patients, reviewing their health history, and did they really dive into the needs of the patient, or just, I need to make production, I need to sell this amount of treatment. I see that happen a lot in DSO settings, and it really devalues and demoralizes the team members. And that's the last thing I would ever want to do. is just build and assess and give guidance and support and build relationships with the patients. That's the key.
Dr. Laura, would you have anything to add into that question?
Yeah, I think it's tricky when there's pressure there. So if in that kind of DSO environment, it's hard because a lot of it is driven on profits, but and it does put pressure on the team, and then that translates to the patient experience. And I think obviously we're running a business at the end of the day, but we're healthcare professionals, so we need to find that balance between providing ethical dentistry and still running a profitable business. And it's definitely doable, but the intention has to be there and the team culture has to be aligned very, very well, I think, for that to be successful.
Mhm, mhm. Perfect. No, like I said, we've been talking about trust. We've been talking about a lot of things that I believe that comes together when we talk about our sponsor that I was mentioning earlier. So let me just share the QR code one more time so that you can scan it. And I will also give you a bit of a idea again. So this is where Equa marketing comes in, right? Equa marketing, again, has more than 18 years of experience supporting dental and healthcare practice owners with digital marketing strategies designed to improve visibility, trust, and booked appointments. Now, tonight, as a gift from Naren Aruraja, CEO of Equa Marketing, Equa is offering attendees a practice growth session built specifically for dental practice owners. This is a $900 value. You walk away with clearer read on where your practice value sits today, the patient retention gaps that may be quietly eroding your worth. So you can scan the QR code on the screen or visit www.thrivingdentist.com/panels/MSM, or even click the link in the chat. Book before you log off. There are only a few slots available. All right, let me get back to Dr. Laura again. So finally, before we wrap up all these prepared questions that we had for you, which observable behavior tells you the team is building trust before referral numbers or reviews change?
Yeah, so I'm glad that you brought up that the team is building trust. So we've talked a lot about the dentist building the relationship with the patient, but really it's the whole team is involved in this process. And I think Levi mentioned it earlier about that, first phone call to the practice. So every single interaction that a patient has with a practice is going to build or break that trust. So that even starts when they're hearing about the practice, even in external marketing, social media, the way we present ourselves, then that first phone call when they're actually, get in contact with the practice, how are they treated on that phone? The first minute they step through the doors, how are they greeted? And the whole experience throughout the practice. So by the time they get to the dentist, the patient has had multiple interactions with the team, and the team has to be aligned with the correct philosophy so that the patient experience is at the level that the owner wants it to be throughout the patient journey, not just when they're sitting in that dental chair. And the way that you can see that building is patients will come in and they'll disclose things to you. So when you ask them questions, they're more likely to open up and tell you about their past bad experiences, the fears that they're having, their goals and dreams to get their, smile and oral health to where they want it to be. They're going to go more deep with you rather than just giving superficial, one or two word answers to your questions. Another thing is, I think they will ask better questions of you. So when you are presenting, treatment options to them, a patient is more likely to question you with curiosity rather than resistance, right? So they, instead of saying like, oh, how much is that going to cost? They might ask you things like, what would you do if this was your tooth? Or, can you explain that to me again? What if I do this, what could happen? They're going to engage in a much deeper conversation with you about their experience and their treatment options rather than because they feel safe, right? Psychological safety is really the key there. Um, and I think they're going to accept treatment, right? If a patient trusts you, like Angela said, then they're going to go ahead. It becomes, if you spend that time building that trust and confidence and that relationship over time, you reach a point where you can say to a patient, you need a crown, and then you don't have to have the whole explanation. They're just like, okay, because they know that you have their best interests at heart. And if you've recommended that, then that's what they need, and they just go ahead. It makes everything so much smoother and easier if your intentions are in the right place. So, and this is very, very important too. Things will inevitably go wrong in anything, in any business, any job, but in dentistry, right? So if the trust is there, then they're more likely to come to you and stay connected to the practice, right? They're going to bring up an issue, something that they weren't happy about, and allow you to fix it or whatever, whatever needs to be done, rather than escalating straight away into defensiveness or putting in complaints or asking for refunds or all of those things that happen when a patient doesn't feel that they were treated right and they don't have the relationship with not just the provider, but the whole practice and the team. So to have that work experience where, our job is stressful enough as it is, we don't want to be coming to work and having that extra pressure. The key to having that fulfillment in life and business, I think, is that ability to build trust and connection with other people. So not just our patients, but in general, developing these human skills is just the key to life success, I think.
Mm-hmm. Let me just ask you a follow-up question as well.
Sure.
What if the owner believes the culture is strong, but
Mm.
patients or team members are signaling otherwise?
Well, the owner is delusional, and this is quite common in dentistry, sadly. No, it's a good point that you've raised. I think leadership in dentistry is a real issue. It's
Mhm.
lacking a lot, right? We don't get taught these skills, and if you know a lot of owners think that things are going well, but the fact is, if your team is unhappy or you've got team turnover and patients are not happy to come in, right? You can build an environment where patients are happy to walk through the door and don't feel miserable that they're going to the dentist, right? But if an owner thinks that everything is going well, then I think the key is really thinking about, is your practice running the way that you want it to? And then is your team happy? Are the patients happy? And if not, before we start blaming other people, turn a mirror on ourselves and see, am I showing up the best possible way that I can be and should be to be the best leader for the team so that the practice runs smoothly, efficiently, and the patients have a really good experience. So we need to build that self-awareness first, I think.
Mm-hmm. Angela or Levi, anything that you'd like to add into that?
Oh gosh. Angela, you want to go first? I would say maybe the clinician thinks the culture is strong, but is a different culture than what the patients expect.
True.
I will say that it goes right back to the ethics of the doctor, the
Mm-hmm.
leadership of the leadership team, and how ethical they are. Because if they don't build the trust with the team, there's not going to be trust built with the patients. So um, it's trust is the biggest value driver in the whole situation.
Mm-hmm.
In all joking aside, I will add that in almost any business, I think especially dental practices, your team will take on the culture of the owner.
Absolutely.
So if you are a complainer, if you pass responsibility to someone else, so will your teammates. But I have a client who has 20 practices, and everyone from his CEO to his, lowest paid employee will watch him pick up a broom if he needs to clean the back of the office. Nothing is under his skill set, or he's not too big to do something to put his hands in the practice and pitch in. And so that shows, they see that, they'll learn this is what the dentist is about. I better get with the program. But if the dentist is cutting corners and miscoding and upselling, you bet that the staff is going to do the same.
Mhm. All right, so before we move into audience Q&A, I'd love to ask each of you for one quick takeaway, a key takeaway rather. Based on everything we've discussed, what is one thing dental practice owners should remember tomorrow morning? Again, Levi, I'd like to start with you.
Everything, I'll just piggyback on everything starts with you. So,
Mhm.
you set the tone, you set the culture, and at the same time, um, you also the most successful clients I have are those who are humble enough to know to ask for help when they need it. And so they go to the right people knowing where they are not succeeding, whether that's culture setting, leadership skills, marketing, legal issues. They go to the right people and they get the help that they need.
Mhm. Angela?
Two things. In exit planning, the practices that command the strongest valuations are not the ones that are chasing high production days and every single dollar, but they're the ones that build trust with the patients and their teams. And my final thought is your balance sheet, which I look at every single day, tells buyers what you've earned. Your culture tells them what they're going to inherit. And the highest value dental practices excel at both.
Dr. Laura?
I would say slow down to move faster. So I think spending that time in the beginning to build that trust, the connection, the rapport is going to accelerate the growth of your practice more than anything else.
Mm-hmm. All right, that is a beautiful place to bring the prepared discussion together. We have talked about trust, leadership, legal clarity, patient anxiety, team culture, and the numbers that show whether ethical profitability is becoming real. Now we're going to open the floor for audience Q&A. There are two ways to participate. You can raise your hand if you would like to ask a question live, or you can type your question into the Q&A box or chat. If you would prefer to ask anonymously, that is completely fine as well. We have a few registrant questions. We've got one from Anjsri. So she asked about health coach counseling item numbers, telehealth options and charging rates. So I'll broaden that slightly for tonight's dental audience. When a practice is adding advisory, coaching, consultative, or remote support services, how should they think about structure, fees, and patients' clarity? Levi, I might start with you on the structure and legal clarity side.
I'm sorry, maybe someone else could, I didn't quite get the question. If you could,
Okay, would you like me to repeat that?
sure.
Okay. When a practice is adding advisory, coaching, consultative, or remote support services, how should they think about structure, fees, and patient's clarity?
Well, I deferred to Angela and Laura, Dr. Laura on both of these, but I'll tell you from a legal standpoint, anytime you're working with a outside party, a vendor, you're going to have an agreement and you're going to want to know what's in that agreement, right? And the things you want to know is how long am I bound to this? What are my obligations and how do I get out of it? Those are probably the top three points that you want to review in any contract or any relationship that you have.
Mm-hmm. Angela?
Number one for me would be the return on investment. So I would want to ask the question of what is that service or consultant or advisor or remote person bringing to the practice? And what's that investment going to be? How is it going to affect my patients? How is it going to affect my staff? And what problems is it going to solve? So those are the top three things that I would want to know before I brought something in. The return on investment is huge because you can bring a coach or an advisor in and it might smash, completely destroy the culture of your practice. It's all about what alignment that you have with that advisor, that outside source. That's going to be the most impactful thing, and the return on investment is going to completely align with your culture, with your team, and what you're trying to build as a scalable system in the practice.
Dr. Laura, is there anything you'd like to add?
I'll just add to follow on from Angela's point. I think if this is about bringing a consultant into your practice to help it grow, I think there's lots of different models for growing your practice. So I think gaining that clarity on your values and your mission and your vision before engaging somebody is really important so that you can find somebody who is aligned, right? There are lots of different ways to grow, but if this person, as Angela said, is going to derail, all of the things that you value in your practice, then the growth is not going to be worth it. So
There's one more question, an anonymous one. What does a team feel day to day in a practice that has this balance right versus one that doesn't? Dr. Laura, would you like to start on that?
I think the team feels psychologically safe. So I think when we live in this stressful environment, a team that's happy to come to work, that is there to support each other, that is happy to quickly own up when, there's a mistake being made or they're confused about something, it means that everything runs more smoothly and more calmly. None of us want to go to work to then, you don't want to wake up in the morning and think, oh, dread going to work. You don't want to be walking on eggshells when you're there because you can't go to, your boss or your dentist and talk to them about some challenge that you're having. So I think the more that we empower our team members, the more that we build psychological safety into the culture in the practice, it means that they feel that they can build their own leadership skills. They can make decisions on their own. They can actually advance the practice in their own way. And the only way to do that is to build that right culture. And that starts with the leadership team, whether that's just the principal dentist or the team of dentists or the owner, whoever, setting the expectations, but with that high level of support. Right. A lot of the time, what I see in dental practices is there's these high expectations. We want to reach these targets. We want to do X, Y, Z, but then there's no support to get there. There's no training to get there. So that's really unfair and puts a lot of pressure on the team if we set the bar here, but then we don't give them the tools and resources and training to be able to get there.
Levi or Angela, anything you'd like to add?
Angela, you can jump in.
In my opinion, the team is your family outside of your family. So building relationships with your team is going to create a really high value and build relationships amongst your team members. So that, in my opinion, is one of the top priorities is actually building relationships with your team member. Having a 10-minute conversation once a week individually is going to make a huge difference. So that would be one of the top things that I would suggest.
And I would say the way things are working, I think the question is harmony. You feel it in the office. There's a balance. People know what they're doing. They follow your leadership, and there's office harmony.
All right. So before we close, I also want to point you toward one more resource from a thriving dentist. So if tonight's conversation has you thinking, I need more practical guidance, more systems, and a place to keep learning with other dental practice owners, then take a look at DMN. DMN gives dental practice owners access to a 24/7 expert helpline, vendor savings, a curated content library, and monthly live AMAs where you can get direct answers from specialists. There is a QR code that is on the screen, and you can also visit dentalmembernetwork.com. This is designed to help you keep the momentum going after tonight with expert guidance, proven systems, and real savings for dental practices. Now, I'm going to give you a moment to scan the QR code. All right, so as we close tonight, the big takeaway is this. The most profitable ethical practices are not cutting corners. They're building trust more deliberately with patients, with teams, and with the market they serve. I want to sincerely thank our panelists, Levi, Angela, and Dr. Laura. Thank you for sharing your experience, your honesty, and your practical advice tonight. And to everyone who joined us live, thank you for spending this hour with thriving dentist community. Now, as you exit the webinar, you'll see a short feedback survey. Please take a moment to complete it. It helps us keep making these sessions more useful for you. Panelists, please, if you could stay a few minutes for a quick debrief after we close. All right, so I'm Angie. Thank you again for joining us, and we'll see you at the next Thriving Dentist panel. Good night. All right.